My name is Kevin Cow. I'm a second year Doctor of Physical Therapy student at the University of Southern California, and I have special interests in basketball and overhead athletes, especially tennis players. I am applying for the spring rotation in Spooner, Arizona from dates January 4th to April 23rd of 2027. Um, I am interested in Spooner because you guys are blending advanced sports medicine, orthopedic rehabilitation with personalized performance oriented care. And that's something that I really want to do in the future with my hopefully own practice one day and how I want to treat patients. So, my example of constructive feedback when I was in clinic was during this past rotation in San Diego. I was performing soft tissue mobilization on the patient's cervical spine, and as I was doing it, I found some knots or adhesions, and I asked the patients, "Oh, do you feel that?" And they said, "Oh, yeah, I feel that." Um, and then afterwards, my CI pulled me aside and said, "Hey, instead of leading a patient with a question by saying, 'Oh, do you feel that?' Next time try as you do the soft tissue mobilization, um, ask them as you're doing it, like, oh, where do you feel it? And so that way we don't mislead or bias the patient in saying something that we want them to say. And I thought that was really great feedback. And that's something that I always actively seek. Maybe not always in the moment, but always maybe at the end of the day. Like I've always asked my CIs, hey, how did I do today? Is there any tips, tricks, or any things that you want to tell me to help, for the next day? So that way I can come in a little bit better the following day. And then, as the rotation goes on, clinical rotation goes on, every day I find a way to get a little bit better. My role in a team setting, and if we want to use a basketball analogy, is the point guard that does all the little things necessary to win. I find joy in putting people in positions to succeed. I love watching people succeed. It's something that I've been doing my entire life, especially with the coaching, and then it's something that I plan on doing in the future as a clinician. And then the qualities that I look for in a teammate are just people that share the same energy as me. I love it when my teammates or people that I'm around share the same drive to win, and if we can stick it to the basketball analogy, or have the same passion when it comes to um, in a work environment. I think having that overarching theme, that quality together is really helpful. Um, I think my ability to connect with people would makes me a good fit for rotation with Spooner. I have previous experience working with high school level athletes and navigating, though that dynamic with their parents, teachers, but also with professional athletes in the tennis world, because there's not just athletes domestically and their teams aren't just from the domestic United States, but also their teams and trainers and physios from all over the world, and how they have different upbringings, demographics, and just viewpoints. And just I think having that wide net of experience with interacting and connecting with people would be a valuable asset and tool for me, and also to help connect with any patients that come into Spooner. My goal after graduating is to apply what I've learned from my clinical rotations and apply it to a sport specific or orthopedic setting afterwards. But the ultimate goal is to partner up with the professional tennis athlete that I worked with, Ernesto Escobedo, where he provides the coaching and the on court tennis training side, while I provide the sports performance prehab and rehabilitation portion for our future clients. Because currently he has several kids that he trains individually and privately, and he's just missing that aspect of the package of what we can sell to these clients and to help them perform at their best. And hopefully one day, a couple of these kids may become tennis professionals that we can help in the future.